a bag, attached with it is medication. This is usually what it comes with when we do a gravity drip medication for our patients and how we teach them how to do it. Basically all you need is this and the tubing to attach it to it. You're gonna wash your hands. We're gonna open up the tubing. I'm gonna go ahead and lock the tubing. This will stop the flow of the medication once you spike the bag. There's a neck in between the bag and the vial. You're going to snap it and you're gonna squeeze the bag and release. Squeeze and release. And that will allow fluid into the bag. Into the vial, excuse me. Once you have enough saline into the vial, you're going to shake it and mix the medication. Once the medication is mixed, you're going to take the bag and you're going to squeeze and release. Squeeze and release until all the fluid from the vial has gotten to the bag. So now the medicine is mixed. The next step is to spike the bag. I'm just going to take the tubing and insert it into the bag. Okay. You're also going to make sure your tubing is locked. So we're going to push this down. Now it's ready to be hung. The next step is to actually prime the tubing. What you'll need to do is you're going to squeeze the chamber and the chamber will fill up halfway with medication. The next step is to prime, which means that you're going to fill up the tubing with medication. You're going to lift the lock up and the medication will start flowing. Once you get to there, you're going to slow it down and you're going to completely lock the tubing. And now the tubing is completely primed and you're ready to be attached to the medication. Your doctor's order is to run it over 30 minutes. So this is a 100 milliliter bag of saline, which means that you're going to need 50 drops per minute. The drops per minute can change depending on the doctor's order. He might want the bag to run over 45 minutes or he might want it to run over an hour. You'll just need to ask your nurse to specify what exactly the drops should be and how much time the doctor ordered for the medication to be ran. So what you're going to need to do is very slowly unlock the tubing. You're going to be wearing a watch or you're going to be having your phone out, anything that you can count down for a minute. You're going to release it slowly. Start counting 2, 3, 4, 5, 6, 7, and so on. And you want at least 50 drops per minute if your doctor has ordered a 100 milliliter bag to run in 30 minutes. So now that the infusion is stopped, you're going to wash your hands or use hand sanitizer. You're going to stop the infusion by pulling the lock all the way down. You're going to remove the medication from your hub. You're going to want to clean the hub again. And this time you're going to attach the flush and flush the medication through your PICC line. Just like before, we're going to push the black plunger all the way down to the tube. Once that's done, you're going to remove the flush. You're going to clamp your PICC line and the alcohol cap. You'll just cap it back up. And now you're ready to put the sleeve back on.